Well, welcome back. According to the CDC, roughly 15% of women are in fair or poor health. And I can only speak for myself here, but I find myself worrying about everyone else's well-being and not my own. I'm sure there are folks out there who can relate. So for Women's Health Month, we spoke with someone who's not only an expert, but also understands that struggle all too well. Like many women, Carisa Elmore wears several hats all day, every day. Elmore is a nurse practitioner at SouthCoast Health, specializing in helping kids and new moms. As a mom herself, this Women's Health Month, Elmore is making it her mission to remind other ladies that taking care of your health is just as important as taking care of your loved ones.
We're taking our kids to the doctor every 3 months for that first year of life. You know, every year to get their sports physicals, but we need to be healthy enough to also be able to take care of them and take care of our other priorities.
Which is why Elmore stresses the importance of prioritizing our health. She says yearly checkups with primary care physicians and OBGYNs are vital. You should also talk to your doctor immediately if you notice any changes in your body. Elmore says her patients are also struggling to find time to do daily activities with health benefits.
That's a very tricky balance, and I often see that with new moms, especially new working moms who are coming home from work and their last thought is going to the gym because they haven't seen their baby all day.
Goal setting and finding activities that make you happy are what help Elmore juggle it all.
I think it's important to know what are your goals and just starting with those small steps. Because once you start with that goal of being active, then you realize how good you feel. You realize that getting in that activity, whether it's a brisk walk that's low impact and low risk for injury, or it's actually going to a gym to find your community, then you're going to sleep better. You're going to have that dopamine release and just overall feel happier when you get it done. And then you're prepared to take care of others.
The real challenge is fitting these activities into your busy schedule. But from woman to woman, Elmore encourages you to just start and go little by little every day after.
I think it's more of just finding somewhere to start. So if your goal is, I want to drink 100 ounces of water a day, well, then let's just start there. And then we can snowball on that goal of, well, then I'm going to meal prep my breakfast all week. And then I can start to realize what it's like to get into meal prepping and knowing what we are going to eat.
Now, those were all great tips from Carisa. Another tip that I thought was really helpful, she says to find an accountability partner. Now, that someone can encourage you to reach your goals, like setting that doctor's appointment, somebody to hold you accountable on that, drinking more water, and getting active. And we have more morning break, so stick with us.